Good afternoon. Fatah and I are really excited to be here to share some of the health equity initiatives that are underway at the Northwestern Toronto Ontario Health Team. Before we share a bit about our current work, we thought it would be helpful to share a little information about the Northwestern Toronto Ontario Health Team. Our OHT is a part of Cohort 1. Currently we serve over 400,000 people. Our OHT has 14 partners across these sectors: acute care, community health centers, home and community supports, long-term care, mental health and addictions, and primary care. Currently, our OHT is entering a different phase of maturity, and we're continuing to build an enabling environment to support population health management and integrated care. However, at the heart of everything that we do is health equity, and this is because of our community. I would like to turn it over to Fatah to share just a bit more about our community.
When we talk about the Northwestern Toronto OHT, we're talking about an Ontario Health Team with a number of challenges. And I want to share with you just a few of those challenges by highlighting some key indicators. And an indicator on your left that is strongly associated with poor health is material deprivation. And this is where HSBN data comes in. So when assessing material deprivation, which tells us whether someone lacks access to basic needs such as education and employment, the Northwestern Toronto OHT, our OHT, has the highest proportion of the population that falls within the most deprived quantile among all phase 1 and 2 OHTs. Additionally, on your right, there's also very low attachment to primary care physicians, highlighting a need for more primary care doctors. We also have an imbalance when it comes to the provision of mental health care. We rank among the lowest when it comes to number of mental health providers when compared to the high levels of mental health disorders in our OHT. Moreover, there is also a higher prevalence of chronic conditions within this OHT compared to the rest of Ontario. Lastly, this population experiences housing instability and challenges attaining basic needs, with 59% falling within the lowest quantile of the marginalization index. These inequities and challenges highlight the exceptional health equity needs of this population. And in order to address these challenges, we at the OHT went about developing a tailored health equity strategy for our OHT. So what went into this approach? Our approach to developing a health equity strategy involved a multi-step process and was developed in partnership with our OHT partners, along with support from coaches through our involvement in an 18-month-long Pursuing Equity Learning Network hosted through the Institute for Healthcare Improvement, and as well as support from the community. Our process began with a scan of existing strategies and local best practices, along with the review of the literature. We also engaged the community through running a number of focus groups within OHT. And then we went through many iterations of the strategy, revising the strategy as we learned more about the unique needs of the community. So what did we land on? By engaging in the approach that I had gone through, we were able to land on two major iterations or two major versions of the strategy. The first original version of the strategy consisted of 11 domains that corresponded to the 11 areas of action areas that you would find within Ontario Health's Equity, Inclusion, Diversity, and Anti-Racism framework. We took these 11 domains and went through a process of building from it, defining strategies and sub-strategies, going so far as detailing metrics and level of implementation for each domain. However, what we assembled was large in scope, and due to framing and sizing, we went about developing a more tailored and community-facing strategy and consolidated much of what we had developed. We wanted to develop something that really spoke to the needs of Northwestern Toronto OHT, given the inequities. And so we worked with external partners to conceptualize the strategy into something that was a bit more tangible and could make the strategy more relatable for community and our partners. So in hopes of sharing something that was a bit more relatable, what did we conceptualize? We developed a health equity house. Why a house? A house has different parts, and it is something that you build. And like a house, we are building health equity in Northwestern Toronto OHT. And when you build a house, you start with a foundation. And with our health equity house, we have a few foundational principles in the foundation from which we are building from that are helping to guide our actions. Next, building off of that foundation, we have the main body of the house, which contains the main domains or areas of focus. These are the buckets of work that are our priority for our OHT, and we've divided these domains into two larger categories. And that is work that needs to be done that is more OHT-facing with our partners and work that is more community-facing. You may see, for example, that some of the domains repeat in both of these categories, and that is because advancing racial equity, for example, looks different when considering what needs to be done that is more OHT partner-facing versus more community-facing. And likewise, including and engaging key voices looks different when considering the role of the OHT compared to the community. And lastly, we have the roof. We look up at the roof. These are aspirational goals that we look forward to when engaging in the work under each of these domains. And this is a draft, but we hope to fill that roof with aspirational goal statements that speak to the impact that we are trying to make through the work within that main body. And lastly, I do want to say that we hope to build on this conceptualization. We may include an open door that speaks to open participation and involving community and partners. We may include a window where people from the outside can look in and see the work that we are engaging in order to build transparency. And lastly, we may add a garden that symbolizes the activities and health equity projects we are planting. And next up, I'll give it back to Chris, as you'll get to hear about one of those seeds that we are planting that connects to our health equity strategy and the domain around building capacity to improve health equity.
Thanks, Fatah. So how are we going to bring our health equity strategy to life? One example of this is that our OHT committed to developing a community care hub that would integrate health and social services with the intent of reducing health disparities. Now, this commitment included in-kind contributions from many of our partners, including Humber River Health and Black Creek Community Health Center. Humber River Health was kind enough to provide a space for the hub. The space is located in a Toronto neighborhood called Glenfield Jane Heights. Now, this area has been identified as one of the many neighborhood improvement areas in the city of Toronto. Now, these are neighborhoods that received low scores on the city's urban health equity assessment. Now, this assessment evaluated domains that included economic opportunities, social development, participation in decision-making, healthy lives, and physical surroundings. Also important to note that Black Creek Community Health Center's Executive Director, Cheryl Prescott, is the executive sponsor of this project. Now, in early consultation with our partners, we wanted our hub to incorporate the foundational principles, domain, and overarching goals of our health equity strategy. This means that we wanted to co-design the development of the hub to ensure that we were building something that would be beneficial to the community. This would include identifying services that would resonate with our community, but also thinking about the day-to-day operations and cultivating the kind of experience that our community would want from this hub. The following slide highlights phase one of our planning process. The project began about 6 months ago. The project began with an information gathering component. As part of the project, we developed a data brief of our community. Specifically, we wanted to identify the key health and social needs of the community surrounding the location of the hub. Additionally, we met with OHT partners to discuss and brainstorm how we could address some of the health and social challenges within our community. Now, this followed extensive community engagement with the community. We also brought together a community advisory committee made up of local agencies, frontline staff, and community members to flesh out the scope and potential service offerings. And we are currently developing our final report that will consolidate the findings from the previous stages of work, and this will have concrete recommendations for our OHT to action. Now, as we begin to plan the operations of the hub, we will have a soft launch next month. A few partners will move into the space and begin to provide services. Now, based on our engagement, some of the preliminary recommendations is to offer a hub that will integrate health and social care. This would include offering mental health and addictions counseling, chronic disease management, employment services, and social and recreation activities for seniors. Now, on the left-hand side, there's a picture of our community engagement session that took place at Black Creek Community Health Center. During this engagement session, our community shared that they wanted to have improved access and timely care, and they also wanted to receive care from a diverse group of healthcare professionals. Here's a high-level overview of our next steps. As mentioned, once our final report is completed, we hope to operationalize the hub, and this work will continue to be done in collaboration with our community.